Good morning, everyone, and thank you for the warm introduction. I'm honored to have this opportunity and present about early life exposures and the risk of childhood acute leukemia. These results are part of a systematic review and meta-analysis that we perform at the International Agency for Research on Cancer. I have no relevant or material financial interests that relate to this research. Let's start about childhood leukemia. This is one of the most frequently diagnosed cancers among children and adolescents. Its worldwide incidence is about 46 per million per year in children aged from 0 to 14 years, and for adolescents from 15 to 19 years, it's about 29 cases per million per year. Most of the cases, about 80%, correspond to acute lymphoblastic leukemia, while the rest are mostly myeloid leukemia. These incidents make this disease a rare disease, actually, and this etiology it's not very clear so far. However, some of these risk factors are well linked, like radiation exposure to some chemotherapeutic agents, and also some genetic syndromes. However, this is not explaining most of the cases, and this is why we decided to go further and look for other risk factors that could go from pregnancy to the early childhood, considering that the incidence is very varied from geographic regions worldwide, and we assume that there are some potential roles of lifestyle and environmental factors in this etiology. The peak incidence occurs approximately between the 2 and 5 years of age, so it's reasonable to assume that some factors from the prenatal or perinatal period affect the pathogenesis of this childhood leukemia. Indeed, several studies have demonstrated that increased risk due to maternal smoking, alcohol during pregnancy, but very little is known about these other lifestyle factors. So we decided to identify dietary and lifestyle factors that could be related to childhood leukemia, increased risk. So this is why we perform a multi-tier electronic research and different databases like PubMed, Web of Science, and we end up like about 66 studies. This was the first research, and we find about 25 risk factors from lifestyle and diet, and we were able to narrow down the research and be more specific about some of these factors. And these studies were eligible if they present the appropriate statistics, and also if they were well qualified about the quality of the research they performed. And for those who already know how a systematic review can be conducted, this is not new, but for those who are not very familiar, it's very rigorous procedure, so we need to be very careful about choosing the studies, the appropriate studies, and try to get the best quality of the studies, and also to perform quantitative analysis. Like a meta-analysis, we choose the genetic inverse variance method. Most of the literature comes from high-income countries, where most of the research is conducted usually. But however, there were a few studies from other settings, so I'm going to clarify about every risk factor. About the diet during pregnancy, I mean maternal diet during pregnancy, we found 7 case control studies that investigated the potential association between maternal diet and the risk of acute leukemia. In general terms, many of them were very specific, like focused on cured meats or specific items like vegetables that can be high on quercetin, which is a DNA topoisomerase 2 inhibitor. And these studies find diverse results, and some find increased risk of acute myeloid leukemia with these specific vegetables, for example. And other studies related higher daily consumption of vegetables and fruits on proteins. When I mean higher daily consumption of vegetables, I mean more than 2 or 3 portions daily. And then these studies find a protective association between this high consumption of vegetables and fruits, and the risk of acute lymphoblastic leukemia mostly. They run further analysis and determined that some particular items were protective, like carrots, cantaloupe, oranges, green beans, and beef. Some of these are high in carotenoids and flavonoids. And also glutathione seems to be related as protective nutrients for acute leukemia. Also, other studies focused on the higher intake of sugar, syrup, and meat or meat products, especially cured meats, and they found a statistically significant increased risk of acute lymphoblastic leukemia. Our meta-analysis found only significant association, protective association between the consumption of fruits and acute lymphoblastic leukemia. As you can see, this was the only one significant results. However, we performed with the others, and they were not significant. Unfortunately, as I said, there were such a few studies about this, and actually it's pretty understandable since evaluating dietary factors, it's very complicated. We also look for the consumption of non-alcoholic drinks. With this, I meant to focus on coffee, tea, and soft drinks. The consumption of coffee has been very well studied. There were pooled studies, case control studies, and one cohort study, which are very strong. And they found some kind of association between a high consumption of coffee during pregnancy and acute leukemia. Specifically for acute lymphoblastic leukemia, at least 2 cups per day. In comparison with no consumption, we found a strong association, statistical association, as you can see in the diapositive. And this was reported also in other pooled analysis and for acute myeloid leukemia. For acute myeloid leukemia, there was a study who also reported at least 1 cup per day consumption. Increases the risk of acute myeloid leukemia. In our case, only for acute lymphoblastic leukemia, we get this significant result. While for tea, it's more varied the studies, but there are also a lot of studies that focus on consumption of tea, but they vary from green tea, black tea, and other infusions. So it was more difficult to harmonize the data and get a meta-analysis. However, there are varied results, like from non-significant to protective, and some different results. While for some soft drinks, mostly caffeinated drinks, they refer only 3 case control studies, and they didn't have any significant results. We also check that there were reported the micronutrients and supplements from diet, specifically micronutrients. There were such a few studies, but however, they reported some protective effects, but we didn't have enough studies to run a meta-analysis. As I mentioned it before, probably some flavonoids, carotenoids, glutathione that comes from diet could be protective. while for supplements and vitamins, we have more studies, and these are more extended worldwide, which is good because it comes from many settings, specifically for folic acid. This supplementation, which becomes very important during pregnancy, it seems to demonstrate some protective effect in most of the studies. We didn't get any significant results, the trend towards too protective, but anyway, since it's a little bit hard to harmonize some data, we didn't get this expected result. However, there are many studies, pooled studies and other meta-analysis that points to the protective effect of folic acid. And also we tried with iron. We didn't get any significant result. And there was suggested that multivitamins were protective. However, we didn't have any dose or specific micronutrients for these multivitamins. This is why we didn't run any meta-analysis. It was hard to harmonize or to verify the content of the multivitamins. It's worth to mention also the potential role of alcoholic drinks. There are many studies, at least more than 21 case control studies that investigated this association. And these studies, we have varied results from strong positive association, which means increased risk for LLL or also for MLL. And for other studies, they didn't get any significant results, and for other even they report protective effect. But the study of alcoholic drinks, it's very complicated because sometimes we need to focus on the specific type of alcohol, like wine, beer, or spirits. And also let's remember that alcohol can produce other more immediate effects on the pregnancy, during the pregnancy. So at the end, it's very hard to get some kind of results. We didn't get any statistically significant result. However, in this case, the trend seems to be harmful. It's very marginal, the results from the meta-analysis, and for ALL only. But another reason to not encourage the consumption of alcoholic drinks during pregnancy. About smoking during pregnancy, this is also a well-studied, really wide-studied risk factor. For this, we had 36 case control studies that investigated the association. There are many types of studies, case control mostly, and also some cohorts that focused on this. We find that as for alcohol, we find diverse results, like from very strong increased risk, and also non-significant results, and also we have even protective effect. But as for alcohol, let's remember that smoking also can produce some other immediate effects during pregnancy. And in this case, we also assume that probably the bias recall can play a role in these mixed results. We focused for the meta-analysis in the yes-no response, and we find no significant association. However, we made a sub-analysis in those studies when mentioned the paternal smoking, and in this case we got a very strong significant increased risk for acute leukemia, acute lymphoblastic leukemia. So this demonstrates that smoke, it's as well noted, carcinogen, a type 1 carcinogen. Now let's talk about early diets in children, and let's start with breastfeeding, which should be the very first diet for any children. And in this case, we find more than 25 case control studies that try to study the link between breastfeeding and acute lymphoblastic leukemia and myeloid leukemia. As for many of the risk factors, we found diverse results from non-significant and strongly protective effect, but also some suggested like could be increased risk. They studied also the breastfeeding as only an exclusive breastfeeding. Also the introduction of formulas, and also the time. Some other there were varied ways to study this factor. In general, most of the studies also presented a yes/no response, like no breastfeeding versus breastfeeding at least for 6 months. And we running a meta-analysis with this yes/no response, and at the end we find this protective effect and statistically significant protective effect from breastfeeding for acute lymphoblastic leukemia and for acute myeloid leukemia. So this is very encouraging to continue and recommended breastfeeding as a great introduction for the very early life diet. Continuing the early life diet, there were also 6 case control studies that explored this potential association. This early life, we are referring to the first 2 years of life, and the risk of childhood leukemia. And some studies were very specific about the consumption of oranges, bananas, orange juice as protective, and the consumption also referred as frequent, like weekly consumption of some items like bean curd or vegetables, like or increased consumption of cured meat or fish, like they could have some role in the risk of childhood leukemia. And also some supplements like iron could be beneficial in some cases, was reported from some of these studies. At the end, we only could run some meta-analysis for fruits and vegetables, which were common in 2 studies. We didn't get any statistically significant results. However, we think these recommendations for diet, like consumption of vegetables and fruits, can be a very nice recommendation. And also there was another study that focused on they call it like more sugars, more increased fat, but they didn't call it like ultra processed foods. But however, we know that this could be another risk factor but it's not well studied so far, so we can only offer this meta-analysis and this summary of these studies. The supplementation with vitamin K, and specifically intramuscular administration of vitamin K, became almost universal to prevent the hemorrhagic disease in the neonates. It was around the 90s when one study pointed the potential increased risk with the vitamin K administration in acute lymphoblastic leukemia. Around the same time, many other studies focused on this potential risk factor. At the end, there is no evidence of a statistically significant association between the administration of this vitamin K. We also run meta-analysis with these studies, and we didn't get any significant association. So finally, the message to take about these risk factors, we can see that the consumption of fruits and vegetables is highly recommended. The supplementation of folic acid can be also protective, and the case of acute leukemia. Also, breastfeeding should be encouraged as well. Some precautions about the consumption of coffee and caffeinated drinks could be very recommended during pregnancy. And another reason to discourage the consumption of alcohol and smoking during pregnancy. At the end, these are the risk factors that are related for lifestyle and diet during pregnancy to early childhood that we researched so far. And I hope this message to take is encouraging enough for your general practice. And last but not least, I want to thank all the research team that was involved in this systematic review. And thank you for your attention.